Many doctors think Fachsprachprüfung is just a language exam and you add some medical terms to it and that's it. And it's not. It's a communication and patient safety exam, and this misunderstanding is one of the main reasons why doctors fail. In this video, I'll explain what Fachsprachprüfung really tests and how to prepare for this exam really well. What the Fachsprachprüfung really tests is can you function safely as a foreign doctor in Germany? And it's not really perfect German or your perfect theory what it tests. What it really tests is a patient-doctor conversation, a doctor-doctor handover, and written medical documentation. From an examiner's point of view, the focus is on clarity, structure, and patient safety. When the examiners are conducting the exam, what's going on in the back of their mind? Is this patient safe with this doctor or not? Most Fachsprachprüfung or the medical language exams, even though there might be some differences between the states, most of them follow a similar structure. The first part is the patient interview part, where you take the medical history, shortly explain the findings, and explain the next steps what you have for the patients without carrying out a clinical examination. The second part is a documentation, where you write a medical report or an admission note including the diagnosis and possible findings. The second part is a doctor-to-doctor conversation part, where you present the case to a senior colleague. It's kind of a handover, and this is where the actual case discussion happens. Grammar mistakes are allowed. You need not speak the perfect German out there, but what's not allowed is unstructured and unclear thinking. The most common reasons for failure are not vocabulary or not language skills. Doctors fail because they speak without structure. They translate in their head from their native language. They don't explain the risks clearly, and they are not able to summarize or prioritize. The examiners doing the medical language exam are not German language teachers. They are like proper doctors and clinicians, and what they are checking out is for your clinical communication skills and in German. So the basic thing is you have done your medical basics quite well. You were invested in learning the language and you have that structure in your head. So there is no reason why you shouldn't pass the medical language exam. So the examiners expect you to speak calmly and clearly and with structure. Use simple medical language, think loudly, explain what you know and what you will check, and ask for help when appropriate. They don't expect perfection, but what they expect from you is responsibility. And in Germany, so you are in a difficult situation what you cannot handle yourself, and you seek out a help from your senior. This is considered as a responsibility and strength, and is not considered as a weakness. An effective preparation focuses on fixed sentence structures, standard history patterns, case presentations, and medical documentation templates. So learning a long list of medical vocabulary is not enough. You must practice speaking as a German hospital doctor, and you need to detach yourself from that language student mindset. And this is where targeted preparation makes a difference. At MedBridge, we treat Fachsprachprüfung or medical language exam as a clinical skill rather than a language exam. Our preparation is structured, exam-oriented, and based on real cases. Our aim or goal is not just to pass the exam, but to function safely afterward. In the next video, I'll explain the Kenntnisprüfung, what it tests and how it's different from other medical exams you have done, and how to prepare without panic. So subscribe to our channel if you want realistic step-by-step guidance.